A gastroscopy is a very safe procedure, and although it has a risk of complications, this risk is actually very low. It can give a wide variety of information to the doctor, and in some cases we can do therapeutic procedures. A gastroscopy is a procedure that uses a digital video camera to allow us to examine the lining of the upper part of the gastrointestinal tract. This means going through your mouth, into the swallowing tube or esophagus, into your stomach, and finally into the first part of the small intestine. The camera itself is a thin, flexible tube that gives us incredibly detailed images. As with all endoscopic procedures, it's important that we know in advance if you're taking certain drugs, like warfarin or insulin. We'll be sending you leaflets that give you more information. Patients come to us with a number of problems, and a gastroscopy is useful for looking into symptoms like pain, sickness, vomiting, or even difficulty in swallowing. Don't be alarmed if samples of tissue, known as biopsies, are taken. This doesn't necessarily mean that you have a problem. It could help us identify if you have an infection, for example. Sometimes we'll carry out therapeutic procedures when appropriate. Your stomach has to be completely empty for your examination, so please don't eat anything for at least 4 hours before you come to the hospital. Here, around a third of our patients undergo this procedure completely awake, meaning a very quick recovery time indeed. You may have your throat sprayed with a local anaesthetic, and throat spray allows you to stay awake during the test. Some people, however, feel that being awake makes the test more uncomfortable and therefore request sedation. This is given via a needle in the back of your hand. It usually makes you forget, but the purpose of sedation is merely to make you nice and sleepy, not to knock you unconscious. You will have time to talk through either the throat spray or sedation option with the nurse when you sign the consent form. The procedure itself is usually well tolerated and only lasts for around 5 to 7 minutes. It starts with the endoscopist inserting the scope over the back of your tongue, leading to a very brief gag reflex. This is completely normal and entirely expected. The gag reflex usually damps down within a few seconds. The endoscopist will then ask you to swallow and talk you through what's happening. After the procedure, if you've been given sedation, the nurses will take you into a recovery area and will help you to get over the sedation, which may take around an hour. When you feel better, you'll go to our recovery lounge where you can eat and have a cup of tea. You'll always get the results of your test. Exactly how depends on your case history. Sometimes this may mean seeing your GP, other times it may mean a chat with the endoscopist. Complications are pretty rare, but they are a fact of life and can occur in any medical procedure. What we will cover now is what these complications may be for gastroscopy and how we deal with them. Quoting statistics is always difficult in medicine, but in broad terms, the risk of perforation is 1 in several thousand. Even less common is extended bleeding after a biopsy. Perforation is a complication where the endoscope tears a hole in the skin lining the esophagus or stomach or duodenum, and surgery could be required to repair this hole. Extended bleeding may lead to a short hospital stay of a day or so and may require a blood transfusion. In extremely rare circumstances, surgery might be required. If you were to experience a fever within a couple of days of the test, or have trouble swallowing, or have increasing throat, chest, or abdominal pain, then we would advise you to consult your doctor. If you have any further questions about the procedure, please ask us when you come up for the investigation.